Post-traumatic stress disorder, commonly known as PTSD, is a psychiatric disorder that can occur in individuals who have experienced or witnessed a traumatic event, such as a natural disaster, a serious accident, a terrorist act, war combat, rape, or other violent personal assault. PTSD is not just a condition that affects combat veterans. It can affect people of any ethnicity, nationality, or culture, and any age. It has been known by different names in the past, such as shell shock during the years of World War I and combat fatigue after World War II. But PTSD does not only happen to combat veterans. It can happen to anyone who has gone through something traumatic. Symptoms of PTSD can vary, but typically fall into four main categories: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. Intrusive memories may include recurrent, unwanted, distressing memories of the traumatic event. Flashbacks, where an individual relives the trauma as if it were happening again. Nightmares, and severe emotional distress or physical reactions to something that reminds one of the traumatic event. Avoidance behaviors may lead someone to avoid talking or thinking about the traumatic event, or even avoid places, activities, or people that remind them of the trauma. Negative changes in thinking and mood may include negative thoughts about oneself or other people, hopelessness about the future, memory problems, difficulty maintaining close relationships, feeling detached from friends and family, lack of interest in activities one once enjoyed, and difficulty experiencing positive emotions. The final category, changes in physical and emotional reactions, are also known as arousal symptoms, and they can include being easily startled or frightened, always being on guard for danger, self-destructive behavior, trouble sleeping, trouble concentrating, irritability, angry outbursts, and overwhelming guilt or shame. The exact causes of PTSD are not fully understood, but it is believed to be a complex mix of stressful experiences, including the amount and severity of trauma you've gone through in your life, inherited mental health risks, such as a family history of anxiety and depression, inherited features of your personality, often called your temperament, how your brain regulates the chemicals and hormones your body releases in response to stress. Among veterans and military members, PTSD may stem from combat-related trauma, training accidents, or military sexual trauma, among other things. It is important to note the significant impact it has on veterans, as they often face unique challenges when they return home and may have difficulty readjusting to civilian life while coping with traumatic experiences. Treatment for PTSD typically includes psychotherapy, medication, or a combination of the two. Psychotherapy, also known as talk therapy, is considered particularly effective. It includes cognitive behavioral therapy, CBT, which focuses on changing the thought patterns that are disturbing one's life. This might include exposure therapy, which helps people face and control their fear by exposing them to the trauma they experienced in a safe way, and cognitive processing therapy, CPT, which helps people make sense of bad memories. Another form of treatment is eye movement desensitization and reprocessing, EMDR, which involves focusing on sounds or hand movements while recalling the trauma. Medication, mainly antidepressants, can be used to control PTSD symptoms. Coping with PTSD involves a number of strategies and lifestyle changes. It is essential to seek out support from friends, family, or support groups, as they can provide a network of advice, help, and understanding. Mindfulness and relaxation techniques, such as meditation, yoga, or deep breathing exercises, can reduce stress and improve emotional well-being. Physical activity, particularly aerobic exercise, has been shown to have a positive effect on mood and anxiety. It's also vital to avoid alcohol and drugs, which can worsen PTSD symptoms and interfere with treatment. One's journey to recovery is very personal, and many have found that sharing their stories aids both personal and widespread healing. We often hear testimonies from individuals who have successfully managed their symptoms and gone on to lead fulfilling lives. Listening to these stories can be incredibly inspirational to those currently struggling with PTSD. For those who need further resources and support, the National Center for PTSD website is an excellent place to start. It offers a wealth of information on PTSD, including how to find and access treatment, understanding the disorder, and guidance for friends and family of those affected by PTSD. The Department of Veterans Affairs also offers resources specifically geared toward veterans with PTSD. It is important to remember that PTSD is a mental health condition that requires the same level of care and attention as any physical ailment. Stigma should not prevent people from seeking the help they need, and it is crucial to emphasize that seeking help is a sign of strength, not weakness. With proper treatment, support, and coping strategies, many individuals living with PTSD can achieve significant improvement and lead healthy, productive lives.